Welcome back, friends, to TV5 News at 9. Joining us this morning is Bill Palmer, the Director of Veteran Services in Genesee County. Thank you so much for being here. How are you, Bill?
Pretty good. Thanks for having us.
Of course. We're so delighted that you're here. Today we are talking about mental health awareness and support for vets. So, Bill, mental health has really been in the forefront, but can you give us an idea of what the current state is for local vets and why you want to spread the word about just what's offered?
Just like anything, with most people around, they see somebody carrying a sign, vet need of help. Our object is just to basically get them that mental help. I always use the reference that a lot of times, like fire departments or even police departments they get into like a really bad situation, have to shoot or anything like that. Usually they pull them off and get some sort of counseling and help. Your veterans usually, like at least when I was deployed and everything, they keep putting you back into the fight. We don't really have a time to decompress. It's always being put right back into that fight. And I just want to change the stigma that's associated with, like, a lot of times with PTSD or any other type of mental health issues. Because some people think that when you say, oh, that veteran has PTSD, well, some people might think, well, it's like, very eccentric, out, loud,
right,
causing disruptions and all that, when a lot of times most people who have PTSD close themselves off and kind of just shut themselves off from the world. And just getting them to open up, talk, come in, get help, stuff like that.
Yeah. Oh, that's some great information that we need to know. Now joining us is Karen Green, a Veteran Services Officer. Karen, what kind of support is offered for vets?
So the VA has a lot of different support systems that are offered through vets. They have it at the VA medical centers, they have it at the vet centers, and through community care. The community care and VA treatment are all based on evidence-based practice, which means it's been tried, tested, and true. And even the community care partners are included in the evidence-based practice. The VA offers CBT, like cognitive behavioral therapy, social skills, behavioral skills, and family therapy as well, for those that qualify for care. Those that don't qualify for care at VA medical centers may qualify at vet centers based on military sexual trauma, PTSD diagnosis, and those that have a dishonorable discharge are still offered care at the VA medical centers. As long as they're in crisis, the VA will stabilize them and connect them to local resources.
And Karen, sometimes people need help right away. So if someone needs immediate help, is there a hotline that you can direct them to?
Absolutely. They have the Veterans Crisis Hotline.
Yes.
That number is 1-800-273-8255. And with the new technology, folks that are more comfortable with texting, you can text the Veterans Crisis Line at 741-741 and 838-255.
Very, very convenient. Thank you, Karen, for that. Now joining us is Deputy Director Karen Wagner. Karen, tell us, Carrie, about mental health services for the spouses of a vet and how they can really get more information about those services. It's very important.
Yeah, so the VA offers two programs. It's the Caregiver Support Program, and they would be able to get services to help them, deal with PTSD of the veteran. But there's also not necessarily spouses, but another family member might be taking care of somebody with PTSD. So those services would be available to them as well. And if for whatever reason they didn't have VA health benefits, we do have community resources through GHS and the Hamilton Community Network.
That's great to know that help is available for the entire family, all of their loved ones. Carrie, tell us, is there any other treatment options out there available that people should really know about?
A lot of people probably are aware of the community resources and don't really think about VA.
Yeah.
That's probably where we come in the most, is letting them know what type of VA resources are available. So I would say definitely explore. Don't forget about us. We're here. We deal with this stuff every day. So come down and see us, and we'll be able to give you all the deets on that.
I love it. Is there anything else any of you would like to say that we haven't covered?
Can I just add something on that?
Please,
Where,
yes.
a lot of these veterans that are in their spouses and that are out there, a lot of them really don't utilize the VFWs, the American Legions, or even any of the auxiliaries there. Even a lot of times, even if you can go to some of these places and sit down and just talk with other veterans, sometimes that'll even help, even with any type of, at least trying to get you in the right direction or connecting the dot to get you in the right program.
That's great. Well, we do thank all of you for this valuable information. Thank you all for calling in today. We appreciate you. And you can find more information in the hot link section of WNEM.com.